Everyone, please take your seats, and if you will, please silence your cell phones, please, and have a seat. Madam Secretary, if you would you please call the roll?
Senator Chambers Armstrong. Senator Berg. Senator Carpenter. Senator Elkins.
Present.
Senator Smith.
Present.
Senator Storm. Senator Wheeler. Senator Williams.
Here.
Senator Wilson.
Here.
Vice Chair Douglas.
Present.
Chairman Hinkton.
Here. We do have a quorum, but there's no need for approval of minutes this morning since this is our first meeting. Any member have guests they'd like to introduce? Hey, Senator Smith, you have more than a guest. You have one of your bosses with you this morning.
I do. I was going to say, I think the chairman's actually watched Gray grow up down here, but I have my daughter with me, Hadley Gray, and she is going to be a senator one of these days, if not president. So surprisingly enough, you'd think being around us, she would hate politics, but she absolutely loves it and speaks up at her school all the time about how important it is to be involved. So she's been wanting to come and spend a day with Dad, so she gets to today. So welcome, Hadley Gray, if we could, Mr. Chairman.
Thank you. Let's welcome Hadley this morning. Thank you for being here. Okay. Our first bill up this morning is Senate Bill 43. Senator Douglas. We received a note, Senator Douglas, this morning from the governor's office about that there's an estimated $100,000 cost of this bill because we removed the $200 a day cap on the review board members for their compensation. I think we probably have another talk with the transportation cabinet. I know Kenny, when we talked, this was actually maybe a savings to the cabinet when we took off the cap. So anyway, with that said, Senator Douglas, the floor is yours. And we do have a committee sub. We have a motion on the sub. Second. All in favor of the sub, please signify by saying aye. Aye. Opposed? Motion carries. So the floor is yours. Please proceed.
Thank you very much, Mr. Chairman, and thank you, members of the Transportation Committee. My name is Senator Don Douglas. I am District 22 State Senator, and I have the honor of serving part of Fayette County, all of Jessamine County, and all of Garrett counties. With that being said, I want to say a few things about Senate Bill 43. Senate Bill 43 really amends and addresses KRS 186444. The bill itself addresses the procedures surrounding the evaluation and the ultimate disposition of cases relating to the ability of an operator license holder to drive due to a physical or a mental disability. Now, the bill does not alter the purpose of a medical review board, and that is what we are addressing here is the medical review board. But it does add flexibility in how the final dispositions of the medical review board are made. If we look at section number one really establishes that physicians authorized to practice medicine, osteopaths, optometrists, and advanced practice registered nurses may be appointed to the medical board. We do this so that we can have some baseline education expectation of those who will be evaluating the cases. And we want to make sure that we have some consistency in how these cases are adjudicated. It also provides that an informational hearing be conducted with at least one member of the board present. It requires the cabinet to promulgate regulations to establish medical review forms that include not only a signed sworn statement that the person has a physical or a mental condition that could impair their ability to drive, but also clearly states the medical standards that we require for actually operating a motor vehicle, because there are a number of people who do not understand that, and the procedures that the board itself used in making its determination. It requires a person who has a medical review board case to be furnished with a copy of that report alleging they have a condition that could impair their ability to drive if they request it in writing. We want to make sure that our public fully understands what's going on. And this is more for transparency. It requires the cabinet to provide written notice of a decision to take licensing action, and that this action shall take place unless the patient or unless the person satisfactorily completes an examination based on the medical standards set forth in the regulations. We want to make sure that the person who is being evaluated has an opportunity to have an exam. If they choose not to, then the board will make its decision. It requires the cabinet to consult with the medical review board prior to taking licensing action if a person is unable to satisfactorily complete the examination. In essence, what that means is the medical review board will appoint someone on the board to actually offer to do this examination for the person whose case they are looking at. So if the driver cannot afford it or otherwise has not been motivated to do it, the board themselves will pick someone, and it will be someone who understands or has a specialty in the area for which the driver possibly has a mental or a physical disability. They will be offered that opportunity to make sure, again, that the driver is getting the best opportunity to defend themselves. It will allow the person to request an informal hearing in front of the medical board if the cabinet takes licensing action. So even if they take action, and even if they've done some of these other things, and the board makes a determination that the driver does not understand or does not like, that driver can still request a formal review in front of the board. It provides that a patient, or that a person, being a physician, I say patient, so I apologize there, Mr. Chair, provides that a person may submit a report to the medical review board from their licensed medical professional regarding their ability to drive, and that report may supersede the medical review board. What we're talking about here is that if that driver has issues getting with wherever the medical review board is meeting, that driver will have an opportunity to find someone from their local area who will be able to perform the exam under the regulations that are set forth. And if they get a satisfactory exam, then the medical review board can consider that and simply say, okay, we don't need to have another hearing. You've been examined by a licensed physician of your choosing, and that is acceptable. So the board may not have to meet at all. Section 2 simply amends KRS 186.570 to conform with some of the changes that I've already mentioned. And then Section 3 actually removes the possibility of an operator license being removed or from a delinquent taxpayer. It makes no sense to take our driver's license from someone who is delinquent in paying taxes. How are they going to pay their taxes if they can't get to work, Mr. Chair? So with that being said, that is in essence a summary of what this bill is about. I'm happy to answer any questions. I'm happy to explain why some of these changes I'm asking for you all to approve.
Thank you, Senator Douglas. I do notice in the primary part of the sub is you changed shall to a may on the medical review board on a personal physician that the person goes to, how that would be handled when it goes back to the medical review board. Do you care to elaborate on that?
Thank you, Mr. Chairman, for asking that question. The shall, in my assessment, would give the local physician or the physician of the driver's choice all of that power, all of the decision-making power. I felt that we at least ought to allow the board to be able to do its job and review what that physician is saying. And I do that because sometimes we get into these tit for tat things where people will say, well, I don't know that I trust the people on the board, or I don't know that I trust that local physician. And we as physicians, and Senator Berg is here, and I think she would back me up. The problem we have is we are painfully objective. We don't really get into those games. Our job is making critical decisions in critical amounts of time and being objective about those decisions. And though others may think there are some games being played, as most of us in the healthcare system, we simply don't do that. We just want what's best for the patient.
Okay, thank you. I do want to, we received a lot of reason this bill, and thank you for working with me. Thanks to the Cabinet, Kenny Bishop and Matt Cole for their cooperation on this. It appeared to me that we were getting a lot of complaints about the medical review board, and maybe they were a little overzealous on some of their decisions. And one in particular, I want to share with you one of my constituents. Like I said, I heard from a lot of legislators about issues with constituents, but one particular constituent of mine, an Army veteran that had 100% totally disabled, suffered from PTSD and other things, but and Cavis kind of added a little bit to this drama. But this gentleman, under Kentucky law, a disabled veteran's license plate is available free to any veteran that's 100% disabled. So he went to the county clerk to get his free license plate. County clerk says, "I'm sorry, I can't help you. The system won't let me do it." So he goes home and he does it. He went online to do it. Well, he couldn't get it online. So he calls the cabinet. So he and he was very persistent that he wanted this license plate, and a little maybe over the conversation became a little bit heated, and he told the lady several times that he was 100% medically disabled. Well, that person turned him in as shouldn't have a driver's license because he was totally disabled. He shouldn't be driving, which started a whole series of bad events for this person. So the cabinet sends out the medical form for him he had to have a vision test and a medical test, physical. So he goes to VA, Veterans Administration Hospital in Lexington. They do the physical, and on there's a check. There's a place as anything listed above make this person ineligible or any concerns where this person can operate a motor vehicle safely. And the doctor put no. There was no concerns that he couldn't operate a motor vehicle with the conditions, and the neuropathy and PTSD were a couple of the things that were listed. So that was sent back to the cabinet, even though the doctor said he was okay to drive. The cabinet denied that physical and continued to pursue taking his license from him. This gentleman's wife was in the hospital at UK with suffering with cancer. Like I said, it said on his medical form he had PTSD. And I just thought this was a little bit much to put somebody through, because so with the help of the cabinet, and they were the cabinet was great to work with. In the administrative regs, it has who can report somebody. If a family members want to do it, and it's a tough thing. Sometimes we have family members that don't need a license. It takes 2 family members, and it has to be a notarized sworn statement, and they'll send that to medical review board, and they could have their license revoked. But it only a police officer or a medical professional now can report somebody to the medical review board under your legislation. So that's very good. And like I said, we want the medical review board to keep our highways safe. There's people that don't need to be driving, but those who go to their doctor and the doctor says they're capable of driving, then we should honor that. And that's the gist of your bill. And thank you for.
If I may, Mr. Chair.
Yes.
Mr. Chair, if we got time, one more short story. I received a call just this morning from a young lady who had an incident of seizure disorder, who had a seizure 8 years ago. 8 years ago, medical review board actually took a look at her case and decided that she needed to have her operator license removed. Now, in the healthcare space, we generally say we don't want you to drive for at least 6 months. At least 6 months. This young lady has not been able to regain her operator license. If we take a look at section number 1, line 10, that is specifically why I wanted to tighten up the education level of those who serve on the medical review board. We need to have people who have a minimum amount, and I don't mean a low amount of education. I mean they have to meet a certain standard to be able to serve on the medical review board, so that we can get consistent across the board rulings on these issues, because they really, really, really are harming people at times.
Okay, thank you. We have any other questions? Okay, Senator Berg.
Just because this is where my brain always goes a lot of places. But when that physician, not the review board, but a primary physician, certifies that patient is capable of operating a car, do they incur any liability?
I think that would be a tort question.
Yeah.
I think that's a legal that's a different legal question.
Yeah.
Because you and I both know in the healthcare, you and I both know in the healthcare space, even when they say they won't, they will.
I was just curious, because not all of us, certainly not my profession, are trained to know what to look for as far as is somebody safe to drive or not. So I'm hoping that whatever healthcare providers are filling out these forms, they know that, and they're doing that with due diligence. That's my concern.
Yes, ma'am. It's called,
and that they can't get sued for making that decision.
It's called responsible decisions in medicine.
Right. Yeah, but can they get sued for that? I don't know.
I don't think there's any. We won't get. Doctors do physicals all the time. I had a CDL physical, and the doctor, signed off on it. If you get into that liability question, that's why you have insurance. I can't answer that question. This bill doesn't address that. So, any other questions? We have a motion on the bill. Second. We have a second on the bill. Madam Secretary, please call.
Senator Chambers Armstrong. Senator Berg. Senator Carpenter. Senator Douglas.
Aye.
Senator Elkins.
Aye.
Senator Smith.
Aye.
Senator Storm.
Yes, please.
Thank you, Mr. Chairman. Thank you, Senator, for bringing this. Senator Higdon as well, Chairman Higdon. He and I actually worked on a similar issue last year at NCSL, where one of my constituents, who's now living in his district, had submitted documentation from the University of Kentucky neurology department saying that she no longer suffered from any issues associated with a seizure disorder that she had suffered, as you pointed out earlier. And she had been submitting that documentation for several years, is my understanding. And so I appreciate what you put here on page 2 Section 1, Paragraph 8. And I appreciate the good work on this. Thank you.
Senator Wheeler. Senator Williams.
Ditto. Aye.
Senator Wilson. Chairman Higdon.
Aye. Senate Bill 43 is reported favorably with the expressions of opinion that same shall pass with the committee substitute attached. Thank you, Senator Douglas. And
Thank you so very much, Mr. Chair, and thank you, members of the Transportation Committee.
yes, and thank the Transportation Cabinet for their cooperation and work with us on this. And I think this will serve constituents of our districts very well, and the those drivers in Kentucky. I think it'll keep the road safe, but won't be harassing, as I see it, unintentionally Kentucky drivers. Thank you. All right. Next up is Super Senator Cuz Meredith with the super speeder bill.
Good morning, Mr. Chair. I'm Steve Meredith, State Senator for the 5th District, and sincerely appreciate you hearing this bill this morning. You know, Mark Twain said that when the world came to an end, he wanted to be in Kentucky because everything happens 20 years later. I don't think he was talking about trauma care because he died in 1910, but he could have been talking about trauma care because we passed a bill in 2008 to establish a trauma care network. And unfortunately has never received an appropriation. They've operated, and Dick Bartlett is here, and he's been here almost since the beginning of time of this program and done a commendable job, but struggled to find money for the program.
Senator Meredith, before we get too
We
far
have a
along,
committee sub,
we have
sir.
a
My
committee
apologies.
sub, and it's okay to call that?
Yes, please.
Okay. Do I have a motion? A motion and a second on the sub. All those in favor signify by saying aye.
Aye.
Opposed? Motion carries. The substitute is adopted, so please proceed.
Thanks, sir. You know, one of my frequent complaints as a legislator here is that we never measure the cost of doing nothing. And certainly by not funding this network has cost us dearly, not just in terms of lives. Probably during that period, we lost 85,000 lives due to trauma. We average about 5,000 a year. And if we'd had a network in place, probably conservatively, we could have saved at least 5,000 lives. But additionally, because of the lack of a comprehensive trauma network, a lot of our trauma has to leave the state. And it's costing us over $36 million in Medicaid dollars as well. But the obvious concern is the lack of or the loss of life, and the inability to get people back to work on a timely basis because the injuries are more severe. And to that end, I've got a couple of gentlemen here that have to deal with this day in and day out, and I'd like to ask them to come forward and identify themselves a record and talk about their experience. Then I'll finish up with the structure of the bill itself, if we could, Mr. Chair.
That'd be fine. I do want to point out that from the governor's office, we got a note about your bill costing an additional $700,000 and costing us on that. But the changes you made to your bill eliminate that issue. They said the $700,000 was when you were sending the bill to the cabinet, transportation cabinet, to do civil or send out civil penalties. That changed with your committee substitute. So
Appreciate
we
that.
can send a note back to the governor's office. We got this one. We're good.
I have not seen that note, interestingly enough, but in discussions with the transportation cabinet regarding trauma related to traffic accidents, they have expressed strong support for this bill. But as you noted, they're not going to be involved in this element as the governor's office suggested, but that is what it is. But again, I'll ask my guest here to introduce themselves for the record.
Certainly. Well, thank you all. My name is Dr. Jason Smith. I'm one of the trauma surgeons at University of Louisville. And I want to thank you all for this opportunity. And, I want to thank you all for taking up the mantle of trying to fund the trauma system here in Kentucky. Outside of Jefferson and Fayette County, we have a lot of trauma deserts throughout Kentucky, particularly in areas that may surprise you. If you are in a car accident in Boone County in northern Kentucky, you're much more likely to be flown to Cincinnati than receive care in one of the very good Kentucky hospitals, St. Elizabeth system that is there. In Bowling Green, the same thing. If you're in a car accident in Bowling Green, you're going to get a helicopter ride to Louisville or Nashville to receive your trauma care. You're not going to be taken care of by the hospitals there that are in Bowling Green serving that population. And we oftentimes talk about the other areas in Kentucky that are underserved as far as their trauma facilities are concerned. My family's from Jackson County in eastern Kentucky, Breathitt County. If they're in a car accident, they're going to West Virginia to receive care. And that's just the simple fact of the matter is that we've got areas that you are 4 to 5 times more likely to die from the exact same traffic accident in our own state in areas of western Kentucky, eastern Kentucky, and south central Kentucky than you are if you were to have that same accident here in Frankfort, in Lexington, in Louisville, or the surrounding areas. One of the things that this bill helps do is helps address the state trauma system that allows us to, one, develop the level 3 and the level 4 centers around the state to give us a much more comprehensive system for the care of patients. It allows us to keep the patients that can be cared for within their communities. It gives us the framework for transporting patients within the state to the level 1 and level 2 systems that are every day taking care of those folks if they need that. And it provides the resources for EMS and other areas around the state to give them the training they need to identify the patients that can be taken care of closer to home. I would love to tell you that Louisville and the U of L and UK can take every single patient that comes through our doors, but the simple fact of the matter is that we are serving a large burden of patients, and it doesn't do anyone any good to get in an ambulance and ride 2 hours to Louisville if they can be taken care of closer to home in Bowling Green or in northern Kentucky. And that's what this bill essentially does. And it allows us to have the funding to complete the system and the work that we started almost 20 years ago. It gives us the opportunity to educate and track the patients through the system. It gives us the ability to make sure that the training for those that care for those patients is up to date, and we're doing everything possible. And I'd like Dr. Warner from the University of Kentucky to say a few words.
Dr. Warner, please introduce yourself for the record.
Thanks, Mr.
The floor is yours.
My name's Zach Warner. I'm a trauma surgeon at the University of Kentucky. I'm, more importantly today, a Kentuckian and Knox Countian. So I grew up in southeast Kentucky and elected to practice here because these are the people I care about the most. I'm proud to be from here. I'm not proud of some of our trauma outcomes, despite the fact we've implemented this system in 2008. I think that it's startling to me that depending on where you fall or wreck your vehicle in our state, that your likelihood of survival can be dramatically altered just based on that geography. If we fund this adequately, we can make a dramatic impact on these lives in Kentucky, and the data that we have supports that. I think it's important to recognize that injury is the most common reason that young people die in not only Kentucky but America. And when I say young people, I don't mean teenagers. I mean anyone under the age of 47 years old. This is the most costly diagnosis in our healthcare system and in our country because it impacts young people in these productive years of life. When you think about the impact and the cost, you combine cancer, cardiovascular disease, stroke, injury is more impactful than all of these combined based on the timing with which these people are injured in their lives. As mentioned, more than 5,000 people die from injury in Kentucky every year, but with an organized, well-funded trauma system, we have the opportunity to save at least 10% of those lives, and that data is reproducible in other states who are similar to ours. That translates to 250 to 500 lives per year conservatively in our state, and I think that the people in our state depend on this funding to be able to close that gap. I would like to give you an example. Several years ago, I was on call, and I received a phone call from an emergency medicine physician in rural Kentucky. He was calling me about a patient that by all accounts should already be dead. Because the patient was injured near an established trauma system, they had the right people there with the right training and the right protocols to recognize an immediately life-threatening injury that needed to be corrected. They were able to transfuse blood and stabilize the patient, knowing exactly what he needed, which was quick transfer to a trauma surgeon at a level 1 trauma center, which they implemented. En route to UK, we were able to converse about what they had done, review the injuries that had already occurred, and I made a surgical plan before I ever laid eyes on the patient, and we saved someone from a diagnosis that no one should survive because the system was available to this patient. The system worked, and that was because the system was in place. It's unfortunate to me that if this had occurred in a neighboring county, this man would not have survived and would not be teaching high school PE today. It's unfair, it's unjust, it's simply because you work or live in the wrong place in our state, you don't have the same opportunities to survive that you would if you were injured where this person was. Funding of this system would begin to correct that discrepancy, and it would allow us to deliver formal education to rural healthcare providers. It would empower them with the knowledge they need to deliver this same level of care. It would allow us to develop additional trauma centers, as Dr. Smith mentioned, providing access to care that in many areas of our state cannot be obtained within an hour, even if you wanted to. This is important because we recognize the opportunity of survival dramatically decreases if you are bleeding and are not able to be treated within that time frame. This would allow Dr. Smith and I and our systems to partner with providers who are already doing excellent local work and just need the system support that this funding would allow. I think it's really important to understand that I don't come to you today as a trauma surgeon from the University of Kentucky, but as someone from Knox County with family that lives there. And I represent those people that deserve the same opportunities that I have simply because I live in Lexington. What we're discussing today is trauma care. It's an essential public service. It's our responsibility to deliver that to the people who aren't here with us today, who don't have the same voice that those of us who are sitting up here in front of you do today. So I appreciate the opportunity to come and give you our perspective and deliver this for you.
Mr. Chair, what we're specifically proposing here is to adopt a super speeder bill that's modeled after the state of Georgia. They've had this for several years. In Georgia, if you go 20 miles over the speed limit, I'm amazed number of my colleagues who had this experience. In addition to the fine you receive, there's an additional $200 fine that goes to their trauma system, and it generates about $20 million a year. So our bill says 25 miles over the speed limit. It will still generate about $10 million a year. But another thing that makes our bill unique is the distribution of the funds, because I would love to see all this go to the trauma network, but these folks have already suggested, if we don't have EMTs to get people to those hospitals, it's a lost cause. And we passed last session House Bill 484, Representative Fraser Gordon's bill, to establish an educational scholarship fund, but did not appropriate any funds for it. So this proposes to give 40% to our trauma system to undertake the functions that these gentlemen have mentioned. 30% is going to go to the EMT scholarship fund. 20% is going to go to the rural hospital fund that Danny Bentley started 2 or 3 sessions ago. And as part of this bill, we're renaming that bill in honor of Representative Bentley. It's going to be the Bentley Rural Hospital Preservation Fund, because we will have to spend some dollars to get these folks up to speed. Plus, additionally, hospitals are struggling, rural hospitals in particular, and many are looking at the possibility of becoming a new classification hospital called emergency hospital, where they have no inpatient beds, they're just there for emergency purposes. But the last portion of it, 10% of it is going to go to the public school system to purchase AEDs. Because again, that's another requirement that we require the school systems, but do not have any funding for it. Now, recognizing that the world changes over time, there is a provision here that every 4 years, the Appropriation Revenue Subcommittee for Human Services will look at the percentage distribution, because that could change, should change as technology changes and the world changes. So it's not cast in concrete from here on out. But that's what the district fusion of funds will be. But Mr. Bartlett, you have.
Be brief, if you
Yes,
will.
sir. We'll try to wrap this up,
please.
because I think my colleagues have addressed the subject fairly well. I spent about 20 years as an EMS system director in this state, and I got to tell you, the trauma system and the EMS system are very codependent with each other. And Eddie Sloan, the executive director, isn't with us right here today to speak to this, but I will speak on his behalf, because I will tell you that if we did develop additional rural emergency hospitals, as Senator Meredith has discussed, we've had one so far, The key to that is you've got to have a viable EMS system. If that rural emergency hospital, which basically has an ED and outpatient, doesn't have a viable EMS program to be able to transport patients to a higher level of care, we've got a problem. And I will tell you that the EMS system right now in this state is struggling to find, train, and retain personnel, particularly paramedics. We've even had discussions with the General Assembly and with my colleagues before about the possibility of having to use advanced care providers, nurse practitioners, and PAs potentially in some of these really rural facilities, because these rural hospitals are struggling even to find doctors in some of these rural areas. We have some critical needs. So this program helps us to address helping the hospitals to recruit these kinds of people, helps us to train, and helps the EMS services to send their people to training. That's critical. And this AED program has become a real interesting new problem. You know, these kids, if they have a cardiac arrest on a football field, the AED is critical to helping them survive. We need this kind of help. So I think this is a great program, and as a state trauma system director, since its beginning, since 2008, when the program got started, I came over from EMS to Kentucky Hospital Association to take charge of the system. We've grown it from 3 trauma centers to about 23. And I think we've done that amazingly without a whole lot of state funding to support us. It's all been from grants, gifts, and donations. We're hoping we can get some help from you folks this year. Thank you.
Mr. Chairman, just one last comment very briefly. Georgia just did an assessment of their program this last year, and they recognize that for every dollar they're spending on trauma care, there's a $22 return on investment.
Okay.
Thank you.
Senator Wheeler has a question.
Thank you, Mr. Chair. Senator Meredith, I guess as far as the number of these tickets out there, what percentage of them occur on limited access highways versus urban areas? Because, you know, I think we could agree that, you know, if you're going 25 miles an hour in the middle of a city, that's dangerous, and I can see a reason for a super speeder. Fine. If you're trying to get home at 10 o'clock at night and there's nobody on a limited access highway at all, and frankly, I would just adopt Montana's reasonable and prudent standard, and as long as you're not being unsafe, then I don't really think you should have to pay an additional fine.
I would possibly agree, but if you have a blowout on a tire and it's sustained trauma, which obviously you will, then who's going to be responsible for the cost of that trauma?
Well, I mean, that's why you got health insurance. That's why you make sure you got good tires. I mean, that's kind of on you.
Well, we all share that burden, though. Dick may have some statistics on that.
Well, I shared with the Senator Meredith this earlier. We did some research because we were at this the last session too. There were about 47,900 total citations in Kentucky based on state police data in 2003. That's citations for excessive speeding and with arrests involved. That's a huge number. And if some of those people, you know, hit somebody on the Western Kentucky, for example, and cause an injury, that then creates a problem. And I have very few trauma centers in Western Kentucky. Yeah. So that means we've got to then, at huge expense, fly a helicopter in there, pick those people up, and fly them to one of our major trauma centers somewhere. And that could leave these poor families, you know, with huge bills, well in excess of $10,000, which may or may not be covered by insurance.
No, I'm not necessarily disputing what you're saying. I mean, I think the programs that you're talking about funding are very laudable. I'm just saying that I don't know that you can make a direct correlation always between, you know, like I said, Montana adopts a reasonable and prudent standard on their speed limits on limited access highways. If I could get it through here, I'd probably adopt that here in Kentucky. I've actually had people back home, constituents, that have talked about, can we raise our speed limits up similar to some of the surrounding states like West Virginia and Tennessee that have higher rates of speed limits than what we do here in Kentucky. You know, especially on roads that aren't trafficked as much and you're not in an area where the type of accident, I'm not saying it couldn't happen anywhere, but, you know, it's much less likely to happen on a limited access highway where folks are moving at a high rate of speed. You know, I think in similar circumstance, I studied in Germany for a year. Yeah. They have speed limits inside the urban areas and certain congested areas. But, you know, once you get out in an area that's really just less frequently trafficked and moving at a higher rate, clearly it's what law enforcement can still pull you over if you're operating your vehicle imprudently, but if you're, operating at a safe and prudent speed that your vehicle is designed for, then, then you're not cited.
You mentioned
Senator-
Montana. Interesting. We're looking at a program.
We don't have time. I'm
Okay.
sorry.
No problem.
You finished?
Yeah, I'm done.
Okay. Senator Smith.
Yes, Mr. Chairman, thank you, and I'll be brief. You had mentioned just a few minutes ago off the cuff about in a situation you would put a helicopter there and be able to pick those people up. And yeah, I live in that area and fly. And there, my oldest son works at Jewish Hospital, but he also covers at ARH in Whitesburg. So you all are very familiar with what he's seeing there. And they send a lot of people to Houston Valley. But the helicopter being able to get in and get access that quickly is such a wonderful asset for us down there. But they're all leaving. Most of the places, there's a company next to my office. They're getting ready to pull out, and you probably know who I'm talking about.
Mm-hmm.
But how can we use some of your funds as we know that works? And you said it. That could be so expensive it could wipe out a family. Some of those air flight bills are, $60,000, $70,000. We've had testimony about those before, and hard to get your mind around. But how could we use some of this money from your fines to put it back into something we know is an effective way of being able to pick up people? From my office, it takes me 1 hour and 15 minutes to drive to my office, but it is 23 nautical miles from my lot to be able to sit down in my parking lot. And so it's a 12-minute flight. But how can we do that? Is there a mechanism in there? And I've heard you talk about some of these things that we could actually put some funding in to maybe defray the cost for what these families are getting hit with, maybe set up a fund or a pool, a super fund, because that truly will save more lives than anything. You put landing gear on one of those highways and get somebody out of there, you can get to Houston Valley, UK, you can get to a lot of places really quickly and save multiple victims at one time if you can, or injured people. But is that a part of your all's thought going forward, is putting money into something we know works?
It is, and that's one of the reasons that the percentages will be reviewed every 4 years, because first we have to build a network. It's just not there. And as we build the network, then we shift those funds in other areas. But I envision that myself as some way to address that, because it's economically killing for a lot of families.
But very helpful.
We have to build the system first.
Thank you, Mr. Chairman.
Sorry.
Thank you. Senator Williams.
Thank you very much, Mr. Chairman. I think last time I was actually the member of this committee that moved this bill out of the committee. And so I do support this bill. But quite frankly, I was shocked but not surprised to hear that in northern Kentucky, we would have to be transported out of northern Kentucky. And what I want to know, is there something in this bill that would help northern Kentucky specifically to be able to treat trauma in northern Kentucky?
Yeah, I think the most important part of this bill, it gives, for funding the system, gives us the ability to help incentivize becoming level 3 and level 4 centers, which are really the backbone and workhorse of a larger state system. I think the important part, for example, in northern Kentucky is you've got fantastic facilities, but there's no incentive for them to really work to develop this because, again, a helicopter ride across the river is to Cincinnati. The simple fact of the matter is not everybody needs to be on a helicopter to Cincinnati or to Louisville, and that a large percentage of patients can actually be treated right where it needs to be. By having a more comprehensive system, for example, we can put a level 2 system in Bowling Green. We are sorely in need of a more highly structured facility in Western Kentucky. A level 2 system provides all the clinical care that UK and U of L do for adult patients. It simply doesn't have some of the research and outreach components. We could do similar things in other areas as long as we've got a comprehensive system to help fund that.
Okay, let me follow this up. You say there's no reason. I can tell you the reason we don't have it is because we have a monopoly in northern Kentucky. Right now, their Children's Hospital, which is a level 1 pediatric center in Cincinnati, would love to open a hospital in northern Kentucky, and they're prevented by certificate of need from doing so. There's other hospitals. No one hospital can be everything to everybody. In the rural community, they have to be. But in an urban area, it is certificate of need that is putting the burden on a single hospital monopoly. And we need to allow, in my opinion, additional hospitals like Children's Hospital. So there will be a bill this time to allow Children's Hospital, who's being prevented by certificate of need from opening in northern Kentucky, to come in and open a facility? And will the sponsor of this bill support allowing Children's Hospital and Certificate of Need to be alleviated so that we can get other hospital care? This is nothing about, no one hospital can be all things to everybody.
Well, I certainly agree, and we want to see the state flourish in terms of our medical facilities. And I've been asked that question frequently, and most of you know I'm one of the strongest supporters of Certificate of Need because it protects rural hospitals who are in such a fragile position right now. And I would gladly change my position on that, as well as 340B, which we heard in health services earlier, if rural hospitals will receive payment parity. We should be paid the same as every other facility. Until that happens, we have to afford them that protection. So maybe that's another piece of legislation we can do in the future, but rural healthcare providers should have payment parity with everyone else.
We're talking about urban hospital area, not rural.
Thank you, Senator Williams. We do need to move along. You know our time constraints here, Senator, and I cut some of your speakers off a little abruptly. We do have a few minutes left if you all want to make some closing remarks. I just want to make sure that everybody had time for their questions, that their questions were answered. We've met that. So if you each want to take a few minutes to close it out, feel free to do so. We just need to make sure we have time for our vote and for folks to explain their vote.
Thank you, Mr. Chair, and I can be very brief. I'm just thrilled that you're willing to hear this bill. Again, 2008 is when we passed this legislation, and here we are 17 years later, and this can change the trajectory of healthcare in Kentucky for almost every citizen. So very proud of that. You know, the other option that could be available to us if this bill doesn't pass is we have an appropriation request in the next budget cycle for $10 million. We know that's not going to happen. So this is a way to fund this system without costing the taxpayers any additional tax burden.
Another way of looking at it, Senator Meredith, this will save lives because we'll get some folks to slow down.
And that's invaluable. Yes, sir.
So, any of your other guests have anything to say? Like I said, I cut some of you short, and I apologize.
No, I just want to, thank you all for this opportunity to be here and talk to y'all about this. We, as Mr. Bartlett said, we have come a long way based off of volunteers, grants, and goodwill. We are really at an inflection point right now in the state and the systems that we're trying to put together. We've done about all we can do with elbow grease and running around the state trying to get some of these hospitals cajoled and working. And I think from our perspective, anything you can do to help us get this system funded will vastly increase our ability to care for patients and transport them around the system and save lives. I mean, this money will save lives right here within the Commonwealth. So thank you all for that opportunity.
I apologize. I don't remember your name. She needs it for the record. I didn't ask you to identify yourself. And please take a minute. I cut you short. Please take a minute for.
Thank you, Senator. My name is Richard Bartlett. I'm the State Trauma Program Director. I work for the Kentucky Hospital Association. Essentially, when we started the program in 2008, the commissioner said, I'll birth it, but you've got to raise it. And so they hired me to basically run and set up and do the trauma system. I was going to mention, Senator Wheeler, one of the interesting programs that we have been looking at from Montana, and we're going to try to cultivate under our trauma umbrella, is what's called a pre-hospital blood program. What they did out in Montana is because of the huge distances they've got out there. If they were to have a trauma in a smaller facility or in a rural setting, and they've got to take it into a larger trauma center, it may be hours. And so they've actually created what's called a drive-through blood program in order to help those paramedics restock what they're running on the patients. There's even a program being developed here in Louisville and Lexington to do the same in an urban setting because they've been able to show this. So we've learned a little bit from your friends in Montana. And there is money, Senator Williams, in the budget. It's I think it's in Section 2 to help with uninsured people that get into the trauma system, so that we've got a way to help them and, if necessary, to move them. Because some of our for-profit ambulance services, unfortunately, don't want to move people unless you've got insurance. Well, some of the hospitals have had to actually dip into their own pockets in order to pay the bill to move a critical patient from one facility to another. So you've addressed that in this bill. And I thank you, sir.
All right. Seeing no further questions, have a motion on the bill. A motion, and a second. Have a second. Madam Secretary, please call the roll.
Senator Chambers Armstrong. Senator Berg.
Explain my yes vote, please.
Yes, please proceed.
I would like to extend my heartfelt thanks to every one of you sitting at this table. I know that this bill will actually save lives, and not end of life type of, I'm talking about you go to work, you have a major accident, you're driving home from church and you get rear-ended, you're a bystander in a mall and you get shot. We need to be able to take care of our people, and funding this trauma network and setting up a system throughout the state that allows the most people to survive is absolutely, I mean, I would honestly feel like I have done something well in my term as a senator. If we can get this done, this will actually save lives. I would like to respond, not directly, but indirectly, to one of my colleagues.
Explain it, please. We need to move on. This was explain your vote.
Yes. And when you go 25 miles over the speed limit, you incur costs for the rest of society that you yourself are not going to be paying. The rest of us pick up those costs in your health care, in your disability, in your long-term needs. Yes, thank you.
Senator Carpenter. Senator Douglas.
Yes, but explain my vote, Mr. Chair, very quickly.
Yes, 2 minutes or less.
Okay. I want to thank you, Senator Meredith, for bringing this bill, and you other three gentlemen for all that you've said this morning. A lot of people think about trauma that the individual who may have been irresponsible at the time is involved, but those of us in healthcare understand that there are a lot of unintended consequences, a lot of unintended victims, and this will help those unintended victims. Thank you very much. Thank you, Mr. Chair.
Senator Elkins.
Aye.
Senator Smith. Aye. Senator Storm. Senator Wheeler.
Mr. Chairman, explain my no vote.
Yes.
Sympathetic with the cause, don't really like the funding mechanism.
Senator Williams.
Mr. Chairman, explain
Yes.
my.
You made 2 minutes or less.
Okay, I'm actually going to pass on this. I support the bill. I asked it out before. I'm looking forward to getting the funding in Northern Kentucky. I can vote on the floor differently than this. This is coming out of this committee. But we have a significant problem in Northern Kentucky, and it's not just with transport. We need physicians from level 1 trauma hospitals that are just across the river that come down at facilities and be there. We need options. We need support. And this is not going to hurt rural hospitals. This is like one of the largest urban areas in the state, okay? And we can't get a second hospital system. We can't get probably the nation's best pediatric hospital. We can't allow them to locate in Northern Kentucky when they want to locate there, because they know that there is the need for that pediatric care in Northern Kentucky. And my grandson's life has been saved twice by Children's Hospital. Okay, so I know the quality of care that they can bring to the residents of Northern Kentucky. And this is not a knock on any other hospitals. They're trying to be all things to all people. This is about saving lives and the people that work in those systems that have experience beyond others. So I'm passing on this, and I am doing my level best to see that we have opportunities in Northern Kentucky for a variety of options.
Your time's up.
Without hurting rural areas. Thank you.
Senator Wilson.
Aye.
Chairman Higdon.
Aye. Senate Bill 57 is reported favorably with expressions of opinion that same shall pass with committee substitute attached.
Thank you, Mr. Chairman. Thank you, members of the committee. Appreciate it. Great.
A motion to adjourn. We are